tests. Okay, we manage, we diagnose the patient, and the diagnostic tests will support or confirm our impression. Okay, so getting the history is a skill. Okay, it's a skill that you will develop as you go on in your clinical areas in medicine, particularly clerkship, postgraduate internship, and residency training. Okay. So interviewing and history taking are very important clinical skills that would require practice. Okay. And it's not the standard set of questions, but patient and the complaint. Okay. So the more to our patient. Okay. I'm choppy there. So maybe in this, I'm just in a, but I'll be okay. Okay, so these are the basic features that will make history taking uh, beneficial and appropriate. Okay, the first one is you should establish a warm, friendly atmosphere. Okay, be relaxed. Okay, introduce yourselves first. Who are you? Okay, and what will you do? Okay, so I am Dr. Bautista. I am the resident in charge po, and I will get the history. So there is a brief orientation of what's going to happen. Okay, a good eye contact is, of course, a basic communication skill, not just in history taking, but in our everyday life. Okay, we maintain eye contact with the persons we are talking with. Okay, there should be a continued, steady, logical flow of content in conversation. So if you start with history taking with the chief complaint, then it follows what are the associated signs and symptoms, the onset, the duration. So there is a connection from the previous question to the next one. Okay, and then if you will be uh, asking a different portion of the history, then you may again introduce that one. Okay, so we will now proceed with the history during pregnancy. Okay, you can make some introduction like that. So in this interview and history taking skill, very important is that you also listen. Okay, since you ask questions, then you take time to listen to what they will say. Okay, there are important nonverbal cues. Okay, like when they could be in pain while being interviewed, or they are shy, or they are afraid of their parent who is beside them. They cannot express freely, especially if there is some signs of abuse. Okay, and then they are sick. Okay, they may be having financial problems and other concerns, and therefore we should be able to sympathize with them and be a little more understanding of their situation. Okay. More importantly, when you take the history taking, of course, we advise you to observe proper dress code. Okay. So there is a format in taking your pediatric history. Okay. Uh, and we start with the informant. So who is the informant? Okay, usually the one who brought the patient to the hospital. Usually it's one of the parents, sometimes a grandmother, sometimes a caregiver. Okay, there are trusted caregivers as well who can be reliable in history taking since they are the ones taking care of the patient. Now, if your patient is a little older, an older child, like a 7-year-old or older, or an adolescent, of course, they can also be an informant as well. Okay, so you can have more than one informant. Okay, so we get the general information. Okay, which usually will include the full name, the age, the sex. Okay, these are the basic information. Religion as well, because it could be one of the basis for their values and decisions in uh, especially in invasive procedures and management. Okay, the place of birth could be different from where they live now because this could be the first admission in our hospital. But if the patient came from the province, it's possible that the patient had been admitted before in other hospitals. Okay. Now, for the chief complaint, this is the words spoken by the parent, the guardian, or the patient. Okay. And remember, the chief complaint is usually stated in the last sentence of the history of present illness. Remember, in the history of present illness, which I will discuss later on, the last sentence will be the reason for consultation, for bringing the patient to the emergency room. So the chief complaint should be reflected in the last sentence of the HPI. Okay. Usually it's just one, if possible. Okay. Because other complaints would be associated signs and symptoms. Okay. And may have to pick up which one is the chief complaint. Because if it's fever for 4 days, 4 days na eh, bakit ngayon lang dinala? Okay? Yun pala, nag-vomit a few hours prior. So probably that was the one that prompted the consultation. And the fever for 4 days is just part of the history. Okay? It could still be fever if the fever became high grade few hours prior to admission. Okay? The chief complaint must be concise, short, accurate. Okay? We usually include in the chief complaint the duration of the chief complaint. Remember, the chief complaint may be one of the last symptoms that appeared. Therefore, the duration of illness is not the same as the duration of the chief complaint. Okay? But it could be if the chief complaint is fever, and it is the first sign that was manifested by the patient. Okay, it started as fever 5 days prior to consultation. So the duration of that chief complaint is the same as the duration of that illness, but not all the time. Okay? Now, history of present illness is very important, of course, because this is where we can uh, consider several differential diagnoses. Okay. So we start with the chief complaint. Once we know of the chief complaint, we ask, okay, when did the patient start to be well or to be sick? Okay, if they will start with the chief complaint of vomiting or diarrhea, you may ask before ano po yung napansin niyo, okay? Or bago, ano po yung unang-unang napansin niyo sa kanya before siya nag-diarrhea, okay, before the chief complaint. You can ask that, okay? Sometimes the parents will not provide information. Therefore, the questions you ask are very relevant, okay? Because they will just answer your questions, okay? And they might think that other information, they are not relevant because they were not asked and they will not offer important information. Okay, so this could be about pain, okay, intensity, okay, frequency, anything that would aggravate or relieve those symptoms, okay? The general trend, is the patient progressing? Or has there been some relief of symptoms? Or the fever lies and the fever recurred a day before a consultation? Okay, it's possible. Okay. So included here will be prior consultation, okay, in the HPI. Did you consult prior to going to the hospital? Okay. If there was prior consultation, you can ask about what was done, what diagnostic tests were requested, and do they have the results, and what prescriptions were given. Okay. In the HPI, we include the medications in generic names. Okay. We also ask for the preparation, if possible, and the amount being given and the frequency. This is to observe and to determine if the drug given is of adequate dose and if the patient was compliant with the intake of such medications. Okay, these are very important in the decision of how to manage the patient. Will be given for 3 days, inadequate dose. I might be considered with resistant organisms because of a wrong dosage of antibiotic. It could be like that. Okay, so part of the history will be consultations, treatments, laboratory tests, if any, were done. Okay, and we write this in chronologic format, at least a day prior. We do not put anymore the time of day if it's about several days or 1 day prior to admission, unless it's occurring in particular only at night or every morning upon waking up. Okay, and we only include the hours prior to consultation during the few hours prior to consultation. The reference will always be the date and possibly the time of consultation. Okay. If the patient was seen today at 5 p.m., then everything else is 5 days prior to today at 5 p.m., 1 day prior to today at 5 p.m. And if something significant happened earlier, it could be 3 hours prior to consultation. We do not put time at 3 a.m., the patient vomited. We do not put that. Time is in reference to the date and time of consultation. So the old Cart's mnemonic may guide us in describing the symptoms in applicable cases such as pain and rashes. Okay. Onset, very important in some viral exanthems. Like for measles, it starts on the preauricular area and the progression is caudal. Okay. So we ask for the location, okay, for urticaria due to food or drug, we usually see generalized manifestations, okay. For pain, it has to be characterized, the location, what aggravates it, how is it relieved, where is it aggravating, what is the severity by scoring from 1 to 5, 5 very painful, 1 minimally painful and tolerable, does not affect work or play. So we document for the prenatal history, okay, we get the age of the mother, the parity, okay, maybe like the patient is, remember, our patient is the child. Therefore, the mother in this part of the history is referred to as the patient's mother, is 25-year-old G1P1. Okay. If you talk of the birth of the child, that will be the age of the mother at the time of the birth of the child. So the patient was born to a 16-year-old G2P2. Okay. Some questions are sensitive ones, like, is it a wanted or unwanted pregnancy? So we are careful when we ask such questions. Sometimes we can introduce something like, may itatanong po kami na sensitibong tanong. Hindi po namin intention na maka-offend. Okay, so sometimes we have to make that introduction when we are going to ask some sensitive questions, like adoption, like being wanted, or there was an attempt of abortion. Okay. So we go through these details for the prenatal history if required, okay, or necessary. So the age is very relevant because you know that teenage mothers and elderly mothers may have some additional risk factors for the condition of the patient. We ask for the gravida, okay? If this is a 28-year-old gravida 5 para 1, okay? So you would know why. Why is it that after the 5 pregnancies, only the patient is the one alive? It could mean some genetic conditions, chromosomal conditions, okay? And we can get that from this part of the history. Natal or birth history, okay? Some of this information may not be known to the parent, to the caregiver at the time of consultation, much more, of course, the child, okay? So usually was the patient born in the hospital or at home, usually at home assisted by a midwife, okay? So the upper score may not be known, but we could ask, umiyak po ba kaagad ang bata? How long was the baby in the hospital? If they said 2 days, most likely the baby was well and was discharged immediately. Birth weight may be known or not known. Okay, we just say with unknown birth weight. If the okay, with uneventful neonatal force, okay, or with unknown upper score, unknown birth weight, okay, and then other parts of the birth history in the province. Okay, there. Am I clear? Am I clear? I'm traveling this. Am I clear?
Yes,
Ayan.
Yes, okay. So just raise your hand if I'm not clear, okay? So some parts of this may not be known again to the informant, but may be relevant if we are dealing with a congenital condition. So if that's the case, we may request for records from previous hospitals. Some records are very relevant if you are to manage an infant with congenital infections, okay, congenital conditions, okay. If we think these are very relevant, then we can ask from the previous hospital through the parent, okay. They can ask for a case summary. And again, additional information was about the condition. Other conditions may be elicited through the intervention, okay? Was really light use, so there must be some probably jaundice, or there could be incompatibility, there could be sepsis, causing jaundice, okay? And transfusion, okay? So this can be asked, and this will not be offered by the parent as an information unless asked. nutritional history, very important is the history of breastfeeding or not. Okay, we know that breastfeeding has so many benefits, so it's important to document. Was the baby breastfed for how long? Was it mixed feeding from birth? Or was it exclusive milk formula from birth? Okay, you can ask for the formula given, how it's being prepared, the dilution. Okay. Now, once you know the milk formula, it's an extra effort on your part to maybe check what is the proper dilution of this formula. If you are dealing with a child who is underweight, an infant, maybe you would like to ask what's the milk formula. The baby is not breastfed. The baby is given this milk formula. Paano niyo po tinitimpla? Ilang scoops, ilang ounces? And verify the brand. You just search it and see what is the proper dilution. Is it 1 scoop is to 1 ounce of water? Is it 1 scoop? Is it 2 ounces as recommended? And is it being followed? You should usually ask for the number of bottles if the baby is bottle fed. Because if the baby is being fed every 3 hours and the baby has only 2 feeding bottles, are this being boiled? Okay, maybe that's the cause of diarrhea. Ideally, the frequency of feedings per day could be the number of feeding bottles if we will just boil the bottles once a day. Okay, when was solid foods introduced? Of course, this will be applicable for 6 months and older. But it's possible that a 5-month-old is being given solid foods. So we also ask that. Okay. You also ask for any vitamins, food supplements that are being given. I cannot read what's in the chat. Okay. Okay. Thank you. So we also ask for vitamins or supplements that are being given to the infant and the dose as well. In particular, will be iron for 6 months and older and the amount being given. This is very relevant. Okay? Now, past medical history. Okay? We don't want you to be confused with what should be in the HPI, history of present illness, and what should be in the past medical history. Okay? So anything related to the chief complaint will be part of the history of present illness. Prior to that illness, prior to the present illness, will be your past medical history. And we start the past medical history with the things or conditions that are related to the present problem. If your patient now came in because of asthma exacerbation, then we start the past medical history with when was the patient diagnosed to have asthma, any maintenance medications, when was the last attack, was the patient ever hospitalized for asthma. We do not start the past medical history with the patient has no surgery in the past, the patient has no mumps, measles, rubella, okay? We start with what is probably related to the present condition of the patient, okay? If the patient came in due to diarrhea, then our past medical history would include positive or negative history of prior diarrhea. If the patient came in with a diagnosis of urinary tract infection, very important is the past medical history of prior